And a hearty welcome to my 94.7 FM family. Thank you so much for being back for another edition of Doctor to Doctor in the chat room. I am your host, Dr. Rhonda Shaw, and I'm so happy to have you with me another Saturday as we discuss a relevant topic that impacts our communities and our world. I pray that you are all having an incredible Saturday, and I hope that you are safe and that you are well as we are still in the midst of a pandemic. Please, people, please use those necessary precautions to stay safe, as in wearing your mask and making sure that you wash your hands frequently. Make sure that you are physically distancing yourselves and not congregating in large crowds. And then make sure that you're getting tested. There are plenty of places to get tested. And if you are not sure where to go, it's simple. Just contact your local health department and they can steer you in the right direction as to where you need to go to get tested. Christmas is upon us. We just came out of Thanksgiving. We're in the holiday season. People are accustomed to being able to travel and to visit family and loved ones, but please, people, if you can avoid it, do not travel. Do not have gatherings, huge gatherings during this time. Please. Let's give ourselves a better chance and a higher probability of being able to see our loved ones and fellowship with them after this pandemic is behind us, or at least after we're in a better place where the CDC and these medical professionals and experts will tell us that, hey, it's okay to do that now. But let's listen to the experts. We're not the experts. And we've seen and witnessed so much loss, all of us. I doubt that there are many people at this point that hasn't seen someone or have someone in their personal space that has lost a loved one or a friend, or at least know someone that has. So please, let's just be careful. The coronavirus has prompted so much loss and so many long-term impacts on the lives of the people we know and care about. We are now a world ravaged by a virus that has decimated businesses, overloaded our healthcare systems, and forced new rules about how we can interact with the people around us. It was back in March that the CDC had predicted that there would be about 2 million plus deaths at this point as a result of COVID-19. And although we haven't quite reached that number, but we're very close, we've certainly had our share of deaths to this virus. As of December 9th, the CDC predicts that the number of newly reported COVID-19 deaths will likely increase over the next 4 weeks, with 12,600 to 23,400 new deaths likely to be reported in the weeks ending January 2nd of 2021. The National Ensemble predicts that a total of 332 to 362,000 COVID-19 deaths will be reported by this date as well, which is January 2nd. 2021. Currently in Shelby County, we have over 57,000 cases of COVID-19 and almost 800 deaths. In Tennessee, there are over 480,000 cases and nearly 6,000 deaths from COVID-19. In fact, just recently, we've had more physicians in Tennessee pleading with Governor Bill Lee and asking for a mask mandate. In the United States, there are nearly 17 million cases and over 300,000 deaths as a result of COVID-19. And then globally, we have almost 75 million cases and 1.6 million deaths over that, over 1.6 million. And even with these alarming statistics, there are still people that are calling this pandemic a hoax. There are still people that aren't wearing their mask. There are still people that aren't socially distancing themselves. There are people that aren't avoiding travel. There are still people that are not taking the necessary precautions to stay safe and to keep those around them safe. There are still people that are just plain old not following the guidelines that have been set forth by the CDC and the World Health Organization. This past Monday, they began administering the first doses of the vaccine in the United States. And even as those first vaccines were being administered, the United States Surgeon General, Jerome Adams, warned that there is still a long ways to go, stating that the finish line is in sight, but those last few miles are going to be the hardest. I was just recently on a presentation that was done by the current CDC director, Dr. Robert Redfield, and he talked about the layout and the rollout of this vaccine. And he said that the plan is to have about 100 million people vaccinated by March, then another surge of vaccinations by June, and hopefully on to completion by the end of 2021. And even with that, Dr. Redfield stated that this pandemic will possibly be around in some shape, form, or fashion for the next 3 to 5 years. 3 to 5 years, people. Today, I just want to talk about the rollout of this vaccine and how safe is the vaccine going to be? What can we expect in terms of side effects, and what should we do after we've been vaccinated? I have with me today a very special guest to help us sort all of this out, Dr. Jen Caudle. Dr. Jen is not only a family physician dedicated to keeping families healthy, she is one of the most visible physicians in America, appearing in homes of millions every week on television, discussing these current health topics. Dr. Jen has been a part of the faculty in the Johns Hopkins University Sinai Hospital Residency Program in Internal Medicine in Baltimore, Maryland, and an instructor of medicine at the Johns Hopkins University of Medicine. She's a graduate of Princeton University and an associate professor at Rowan University. You can catch Dr. Jen regularly as an on-air health expert for local and national news networks, including the Today Show, the Dr. Oz Show, CNN, Fox News, Rachel Ray Show, Steve Harvey Show, PBS, and many, many more. But today, I am honored to say that she is a part of the Doctor to Doctor in the Chat Room show, and I thank her so much for taking the time from her busy schedule to be here today. And Dr. Jen, I am so grateful to have you with me today. Thank you for being here.
Well, I am so excited to do this. Thank you for having me.
Absolutely. So we've been in this place for a while now, right? We've since about March, there has been so much uncertainty about this virus, about how it's contracted, what we're going to do to protect ourselves from it. So before we go into our discussion about the vaccines and what the rollout is going to probably look like, let's just go back to the beginning for a minute, if you don't mind.
Sure.
So, we've been told about specific precautions that we are to take, like avoiding, large crowds and wearing our mask and washing our hands frequently and all of that. Are there any other precautions that aren't particularly discussed in the mainstream media that also might provide us with some protection from COVID-19?
That's a great question. I would say yes and no. Yes, in the sense that, basically everything we can do, and this is going to sound horrible, but everything we can do to kind of distance ourselves from people who are not already in our household or that we've been sort of quarantining with is really the name of the game. And we don't necessarily put it like that in the media, but that's really what we want people to do. You mentioned mask wearing, which is so important. You talked about social distancing, or you mentioned that hand washing, using hand sanitizer. We've gone through Thanksgiving. We still have holidays coming up. And I think one of the things, as a family doctor and someone who talks about COVID a lot, I was disappointed to see how many people actually traveled for Thanksgiving, or what it seemed to be, right? And so I was a bit disappointed to see how many people were still getting together with people outside of their own household. That is really, coming up for the next holidays that we have. That's going to be one of the most important things we can do. Really not traveling, that's flying, driving, really going to anyone else's house but our own, for the holiday, unless it is absolutely necessary. So for non-essential travel, that's one of the things I really want to stress that we have to keep in mind.
hmm So you just talked about the holiday travel, and we just come out of Thanksgiving. We're going into Christmas. What do you think, for the people that don't adhere to that particular rule about not traveling? What do you think that's going to mean for, in terms of hospitalizations and deaths
Right.
related to COVID?
I think if we don't sort of adhere to what we know is best practice, and that's not traveling if it's
Mhm.
unnecessary, I think we're going to see a lot of what we're seeing now, which is, after Thanksgiving. First of all, in this fall winter, we've had an increase in number of cases, and we've known that. But then after Thanksgiving, it was predicted that we would have, as Fauci put it, a surge upon a surge, and
Mhm.
that's literally what we have been seeing since Thanksgiving. We still have, record breaking rates of hospitalizations. We still have well over 100,000 cases being diagnosed a day. We still have, in some cases, 3,000 deaths per day. These numbers are superseding what we even had in the beginning of the pandemic.
Mhm.
And what I'm afraid of is that if we don't adhere to sort of the travel restrictions, the recommendations to not travel, and doing all the other things that we need to be doing, I'm afraid we're going to see that again, if not even more, after the next set of holidays. So it's
Yeah.
really, really important to take this in mind. And I think sometimes what happens is we think that, I don't want to say that sometimes we think it can't or won't happen to us, but I guess maybe I think that sometimes we feel that way. We say, oh, well, it'll be okay if such and such comes over, or we've been doing this forever. It'll be all right.
Yeah.
And I think sometimes there's that sort of thinking that, oh, it's not me, or it won't be me, or it probably won't happen, right? And that's dangerous thinking right there.
So, an article just came out this morning, actually, in Tennessee, about more physicians asking the governor here to mandate masks because the hospitals are just really running out of capacity in terms of beds or whatever.
Right, right.
So, what do you think, um, when in terms of the hospitals not being able to accommodate people? They don't have enough beds, and people are getting sick with other things besides COVID. What what other alternatives are there going to be? What are states going to have to do to accommodate people that are sick, whether from COVID or any other illness?
Well, I think that's what the problem is that we're running out of options.
Mm,
That's what the problem with having so many people in the hospital is, and having so many people diagnosed with COVID, and even deaths. We're seeing, I was literally watching the news today, and there are hospitals that are buying more, for lack of a better word, body bags, because they're running out. They're buying more storage for people who have passed on.
mhm,
Even where I practice, I'm a family physician, and I'm an associate professor at Rowan University, and we are screening people to get COVID tested by our county officials, like our county does county testing.
mhm,
And a couple of days we had to actually not refer people to testing. We have them wait because the county actually ran out of testing supplies
mhm.
because so many people are getting tested. This is what some of the problem is when we kind of get to a place where we're running out of options. But I should also stress that running out of options also means people dying, right?
Right.
That's the end of the road. That the fact that so many people are dying is the end of the road already, even if we're not talking about lack of equipment or running out of test kits or things like that.
Mhm.
And that's what I really want people to focus on. The fact that we have so many people, literally, we're losing thousands of Americans every single day. This should be enough. I mean, it should
Right.
have been enough a long time ago, but this should be enough to implore people and to stress, hey, we should be doing whatever we can do. And I'll be honest, I'm an advocate of not only mask wearing, but mask mandates. I've been saying for months on national television and on my own videos to my social media followers that masks are important. Regardless of what your beliefs are, masks do work. And
Yeah.
let's say you weren't even sure that they did. Let's say that somebody out there is not sure that they did. Even if you're not sure they work, isn't it worth a try given how many people are dying a day? The
Hmm.
fact that our economy is literally in the trash, people have lost their jobs, people can't feed their families. We've got kids that are going hungry, kids trying to learn via, isn't all of that stuff worth a try, even if you're not convinced masks work?
Hmm.
So masks are important. Anything we can do to stem the spread at this point is important.
So, what about the people that cannot avoid travel during the
Right,
holiday
right. Yeah,
for varied reasons, or even those that choose to travel regardless
yeah.
of what's being said? What should be done in terms of testing prior to travel or quarantining prior to travel?
Sure. And I should say the CDC, by the way, this is for anyone listening. The CDC has a lot of really great information on travel precautions. So just, even after I tell you a few of my tips, you can always go to the CDC and take a look. It is important to talk about the situation where someone has to travel. Once again, I want to be very clear. I don't recommend travel unless you have to.
Mhm.
There are always emergencies, unfortunately, and situations where people have to, or they might choose to, despite recommendations.
Mhm.
So there are some things you can do. First thing is, getting tested before you travel, not right before you travel, but I would say a little bit before that, because we know that sometimes early on in an illness, for example, COVID testing may not be entirely accurate. But also the people that you're traveling are going to see if they can get COVID tested and if both parties can quarantine as well before getting together. Obviously, when you're sort of in the state of travel, assuming it's air travel, right? I mean, because when you're in your car, you can really control your environment a lot better than, say, if you're on public transportation like a train, a bus, or an airport. Wearing a mask is going to be very, very important. Making sure that you're washing your hands. You're not touching things that you don't need to touch, quite honestly. I recommend people bringing their own food so that you're not going to vending machines into restaurants in places. Again, not that I don't want to support the economy, but it minimizes it's one less thing to touch or to exchange with someone else.
Yeah.
I would also suggest, making sure that even when you're in these spaces of transportation, airports, train stations, etc., that you're staying away from other people, that
Mhm.
you're hand sanitizing. For extra protection, you can wear goggles or glasses in addition to the face mask. Sometimes we see people in these sort of almost full body looking hazmat suits. Whether that's necessary or not, I think is, certainly a question. But if you feel more comfortable with that, I mean, certainly you can do that. But I think some of the bigger things, or rather not bigger, but just as important, is when you get to wherever you're going, understand that if you have the option to not stay with the family you're trying to see, that probably is going to be the safest, right? To stay in you rent a home or get another place outside of the family so that you're not mixing households, or at least you're keeping that to a minimum. You still have to wear masks when you're around each other, and you still want to make sure that there's only as few people as possible. I can go on and on, but those are a few suggestions for people to keep in mind.
Okay. So, in terms of flattening the overall curve of this pandemic, should there be harsher restrictions, you think, to ensure that we just can move out of this place altogether?
Can you give me an example of what you mean by harsher restrictions? What types of things are you thinking about?
So things that would be more than, would we just shut down altogether for, a couple of months? I don't know, 30 days or 60 days. Would we just shut down altogether and say, I can't remember what it was what that New York City did
Hmm.
when they flattened the curve, although I know the numbers went back up at some point. But
Sure.
do you think that doing more than what we've been doing, or mandating certain things, not just masks, but maybe a shutdown. Even, we're worrying, it's this toss up between health and the
Hmm.
economy and all
The
these
economy.
other, right? So,
Right.
you think harsher restrictions would get us to that point quicker?
Well, what I will say is that we, gradually we've had more harsh restrictions being put in place even over the last few weeks. Even in this last week or so, there have been more and more cities saying no indoor dining now, right?
Mm-hmm.
Many cities a few weeks ago were saying, okay, only a certain number of people and outdoors. And Now we don't even have indoor dining. So I would argue that in some ways, harsher restrictions have been implemented over the coming weeks. Look, in an ideal world, if nobody went anywhere, would that be ideal? Sure, it would be,
Yeah.
right? I mean, that would be ideal. Is that entirely practical? It's not. The question is the balance. What is the balance? And I'm not sure anyone knows the answer to that. What we
Mhm.
do know is that restricting activity, social distancing, wearing our masks, and staying as far apart from each other, and not mixing households is really important. What I would really sort of implore people to do is, take what we do know, given the situation that we have right now, and to do that. Right now, everyone's not wearing masks, right? Right now, not everyone is social distancing. Right now, not everyone is staying out of crowds or not going to friends and families' homes. So I would argue we could spend a good amount of time kind of trying to work on those that aren't actually following the guidelines that we have set in place right now.
Mhm.
And that certainly would help.
Yeah. I recently heard Dr. Fauci talking about the post-COVID syndrome. What does science know about the afterlife of COVID-19 at this point?
So when you talk about post-COVID, are you talking about the COVID long haulers? Is that what you're referring to? So COVID long haulers, the word long hauler has been given to sort of describe a person who has had COVID and actually recovered from COVID, but still has lingering symptoms,
Mhm.
symptoms that they did not have before they were diagnosed with COVID. Some of the
Mhm.
more common symptoms include things like shortness of breath, cough, feeling winded, a decreased what we call functional capacity, maybe they can't climb the steps like they used to, brain fog, just feeling winded. Other symptoms can exist as well, but those are some that people often mention. And some people end up having heart issues, lung issues, and other things. The truth of the matter is we don't know a lot about this long hauler situation. We don't know why some people may have lingering symptoms. And what we found is that it's not necessarily related to the severity of COVID, or even, say, the age or underlying conditions of the person who had it. Young people and old people can get it. Healthy people and people who have lots of underlying conditions can end up getting it. There are a lot of variables. We don't seem to have pinpointed, exactly why this happens. There is research happening, and then there are a number of centers that are looking specifically at people who tend to have symptoms as time goes on, which is a good thing. But I think for me, it's one of the scary things about this disease. It's
Yeah.
one of the question marks, right? I think a lot of people think, well, if I get it, it'll probably be mild. I won't have any symptoms. Well, the likelihood, right? More people have mild to moderate disease and severe disease, but there's so many variables. Some people end up having strokes. We don't always know why. Some people, have this long hauler syndrome. There's still too many question marks.
Mhm. So let's talk a little bit about some coping mechanisms for people that are dealing with the stressors from related to COVID, particularly from a mental health and behavioral health perspective, because that's another piece of a component of the effects of this virus. Let's talk about that when we come back from break. We'll be right back on 94.7 FM. So, Dr. Jen, can you provide us with some effective coping mechanisms for dealing with the stressors related to COVID, even from a mental health perspective?
Sure. And I think this is so important. As a family physician, I've literally seen more cases of and sort of instances of depression, anxiety, even post-traumatic stress disorder in my patients than I ever have at any other time in practice. I prescribe more medications for mood issues. I've referred more people to counseling than I ever have in a single period of time. And my patients, just like many of us, are struggling. This is a traumatic time in our history. As the cases go up in this country, the likelihood that we know someone who's had COVID, or we've had it, or we know someone who's passed away, et cetera, that the risk of that, the chance of that increases. And the economic downfall. Many families are struggling financially. I have patients that are struggling even with their weight and even eating, right? Because we're living in this new normal. Many people are working from home, and it's just a crazy time, is the best way to put it. So a few things that I do recommend. I think the first thing is to give yourself a pass, give yourself a break. I think that there's often this sort of expectation that we should plow right through this, like we plow right through everything,
Mhm.
in a sense of sort of just trudge right through it. And while that would be ideal, right, and some of us can do it easier than others, and it sometimes happens when it sometimes doesn't. This is a whole different situation, and one that none of us who are living right now have really ever seen before. So give yourself give yourself some leeway, give yourself some grace. And you know what, if you have bad days or something's not going right, or you're not able to shake something, it's okay. This is a situation we've never seen before. I think sort of forgiving yourself and allowing yourself to be human is a really important part of finding ways to sort of feel more balanced during this time. Um, Sorry, I think I have to sneeze. Sorry.
You're fine. So,
Okay.
yeah, I was just gonna say, I've even spoken with some people that, are stressed with work, and not, those frontline workers necessarily, but even people that are working from home and feel like that they don't get a break. They're not in that typical schedule of a day. They feel like because they're home, work expects them to just kind of work around the clock, and it's becoming very stressful. And some of those people are trying to educate their children virtually.
Right.
It's
Oh,
just
yes.
a lot.
It is. I mean, it's overwhelming. And you brought in another piece. I'm so glad that you did, this idea of homeschooling. I have family members, we all do, who are working full jobs at home and also tasked with guiding their children while they're trying to learn. This
Mhm.
is no small feat. But staying connected with people that are good for you and good to you, I think is important, whether that's family or a best friend or coworkers, et cetera, through Zoom, through Skype, through texting. Checking in with people. Try not to self-isolate, although sometimes that can be a tendency if we're not feeling our best, but reaching out to people who are good for us. Trying to maintain a healthy diet and exercising. This is tough. It's been tough for me as well, trying to find a happy medium in this new reality, but continually trying to eat well, eat healthy to nourish our bodies, and making sure that we're exercising some, I think, is very important. And sleep too. One thing a lot of my patients have mentioned to me, and I've noticed this myself, because our day is different, especially for those who work out of the home, or even if you're working in the hospital. I know many doctors who are, say, working more shifts than they used to. Sleep and the hours, it's almost as though things have gotten adjusted. I have patients that tell me, I find myself staying up till 2 and 3 in the morning and then getting up and, yeah, right. So, you're raising your hand, and I am too. I find that our clocks are a little bit off. Trying to make sure that we are, and I'm not going to say you have to get a set number of hours that you have to go to sleep and get up at the same time, but making sure that you're getting adequate sleep and that you're being conscious of that sleep schedule, because that actually can contribute to stress and fatigue as well. Those are some things that are a really good start. And then, of course, talking to your doctor. Look, if you're really struggling, and many people are, this is the time to reach out. Do not keep this to yourself.
Yeah. I was really appreciative of Michelle Obama being very transparent about, dealing
Yes.
with depression. I think
Yes.
when we can see those types of people open about it, it kind of helps us to say it's okay.
That's
It's
right.
bizarre for me to feel this way. Yeah.
That's right. That's right.
So let's talk about the vaccine and the rollout of the vaccine.
Sure.
So who's gonna get it first? When? How? What is that piece of it going to look like? I think we all know, like, the frontline workers, but just give us some idea of what it's gonna look like.
Yeah, well, the exciting thing is that the vaccine is being rolled out right now as we speak, which is very exciting. It's really, I think, as a healthcare worker myself, it's really exciting to see other fellow healthcare workers, posting their pictures from, their band-aids when they got the shot, and it being on video and stuff. I think it's a very, this is an inspiring moment in time, and it's an exciting moment, and it's a hopeful moment. Um, Sorry about that. Um,
Yeah.
Sorry about that. It's a very exciting moment. So,
There you
I
are.
apologize. Sorry about that. So yeah, it's a very, very hopeful moment. So for frontline workers, as you mentioned, are first. And then we also have residents of long-term care facilities. But and the CDC has been laying out who is sort of in the higher priority tier, but a lot of this also is up to the states and to the places that are actually getting the vaccine. So some of it will be up to, how exactly, like the nitty gritty of exactly who, right? Exactly which frontline workers, exactly which long-term care facilities it has to do with, more intricacies dealing with states and local governments, and even facilities. So one of the things I think that's really nice is that, again, this is giving us all hope. Now, we know that with the vaccine, we can't stop wearing masks. We can't go back to flying all around the world and kissing and hugging perfect strangers that we see in the streets.
Mhm.
You know, we can't do that, but hopefully this is a turning point.
Mhm.
This is a turning point sort of in our COVID journey that, you know, hopefully we'll start to see some change very soon.
Mhm. Can you speak about the types of vaccines that are going to be rolled out?
Well, so the one we have right now is the Pfizer COVID vaccine. That's an mRNA platform vaccine, and then the Moderna vaccine is sort of next to be looked at by the FDA.
Mhm.
The Pfizer vaccine has been given emergency use authorization, so that's not full approval, but that's the emergency use authorization so that we could start administering it, which has been happening.
Mhm.
The CDC also approved it and gave their recommendations. And then next to be looked at again is the Moderna one, which is an mRNA vaccine platform as well. There are other vaccines. There are many other vaccine platforms that are being evaluated and studied, and hopefully, and we expect will also be hopefully approved in the coming weeks to months. That's
Mhm.
going to be very important because we literally have billions of people in this world. We need to be able to vaccinate as many as possible. So the fact that we have so many different companies and industries working together to help make these vaccines possible is a really important thing.
So, in terms of how the vaccine is administered, are there varied processes based on the different types of vaccines? Are they administered?
There shouldn't be, no, in terms of how it's actually given. It's a shot, you know. You know, the Moderna one and the Pfizer one. These two are two vaccine doses that are separated in time. But you know, I don't have specifics on the other vaccines that are in development right now. But no, the two that we have certainly are injections, and many of the others that are being evaluated are as well.
So, how are we going to know which one to get? Like, you
It's
know.
not gonna. It's likely not going to be a choice. You know, many places is what we're being told is that many places will be given a vaccine type. I don't foresee, or I'm not sure that I see a situation where you can walk into a Walgreens and pick from four different vaccines
Mhm.
for COVID. It's in experts right now are recommending that you get what you're offered, you get what's available, because as we know, things are being rolled out as time goes on and being approved that way as well. So it actually may not be a choice based on where you live and where you are.
Other than availability, what other challenges do you foresee with getting vaccinated? Um,
Tell me what specifically do you mean?
well, I mean, will there be, it won't involve insurance or anything. Will it be just like the testing? You can, like right now, we can go anywhere and get tested if we want to, and we don't have to
Hmm.
necessarily have insurance or anything. You know, will people have to pay, or will there be people in situations where I can't get it right now because it's too, expensive? Will there be?
That's a good question. That's a great question. You know, the vaccine is expected to be covered. And that's what, you know, I've certainly heard and what I'm hearing right now. I've heard, you know, in terms of the situations, the vaccine, of course, is being given to healthcare workers primarily. Those are the cases. And then, and actually, the situations I've seen personally are only healthcare workers where, you know, there's certainly been no transaction involved. I think you have a good point is when we start getting to the general public, you know, hopefully that will, and that should be staying the same, right? This is supposed to be covered whatever that might mean. And so I think we'll learn more about that as the vaccine starts coming to, say, local pharmacies, et cetera, and starts being made available to the general public more and more.
Mhm. So here's the big question. What are the side effects? Are they safe? Are the
Yeah.
vaccines safe? And that's really the question that I get a lot. People are afraid.
Sure.
Yeah, yeah. There have been so many things, incidents leading up to this point that have made people fearful of the whole idea of getting vaccinated.
No, I understand that. And I think that, you know, first of all, I do believe that the vaccine is safe. I plan to get the vaccine myself as soon as I'm able to do so. You know, I think some people have concerns because the vaccine was made so quickly. But I think a lot of people don't realize that we were able to make the vaccine quickly for a number of very clear reasons. The amount of funding that we've had from private industry, public industry, you know, governments of countries, et cetera. You know, we've had money to do this. There's also been a lot of collaboration between institutions, private and public, nonprofit, et cetera. You know, we were given the genome for the virus early on. Also, the mRNA platform, you know, that's not a new platform. It's been in the works research for 10 years or so, and had been sort of applied to other vaccine situations. So it may be new for an FDA approval, like for this vaccine and what we're doing now, but it's not like a brand new thing that was just invented, 10 months ago.
Right.
And then also sort of the urgency of the situation. We're literally in a global pandemic where, it's more than necessary that we find a solution, a cure. This is not a cure, but I mean, to find some help. Those are some reasons why the vaccine has been made quickly. And I think it's important to remember that being made quickly is not the same as cutting corners to be made. Being made quickly is being made quickly. Corners have not been cut. This vaccine is, at least the Pfizer one, I can only speak about what we've gotten, right? Because there's many that are still in development. But the
Right.
Pfizer one has been studied in tens of thousands of people, Moderna's as well. Of course, the studies are still ongoing. People do worry about safety. And I think something to keep in mind is that, there are side effects potentially to any vaccine, side effects to potentially any medication you take, even Tylenol over the counter, Advil. I mean, anything can have side effects. I don't say this to diminish the side effects potentially of the vaccines coming out, but I say it to remind us that, because there's the potential for side effects is not a reason to not get the vaccine. That potential exists with everything. Most common side effects that have been reported with the Pfizer COVID vaccine are things like, pain in the injection site or on the arm, sometimes fatigue, muscle aches, cramping, low-grade fever. Sometimes people have felt kind of like they have the flu. Some people have said that those symptoms have been worse than other people who've gotten the vaccine, but most all have said that they lasted, say, 24, 48 hours or so or less, and resolved. I think, it's important to say that with these, first of all, those side effects is what helps us know that the vaccine's working in our body. That's actually our body responding to the protection it's being given, some of those side effects. So that's important to remember. And also, we have to weigh the risk versus benefits. The vaccines are not for everyone. Okay, there are some people who should not take the vaccine, some people who should be cautious, talk to their doctor, but we have to weigh the risk versus the benefits. I mean, what's the risk of severe COVID, and how does the symptoms of severe COVID compare to the potential symptoms that you may get from getting the vaccine, and then also consider that as well.
So will they all come in the two doses? Like, you take
I
one.
don't know. I don't know if they all will. I don't know if they all will. We know the ones that have so far, though.
Hmm. So let's talk about, once we've been vaccinated for COVID, what can we expect? Like, will we be able to just kind of move around the world, without having, highly concerns about being, contracting the virus as we have in this space that we're in right now? Let's talk about that. We're going to go to break and we'll be right back on 94.7 FM. And we're back on 94.7 FM. I'm here with Dr. Jen, and we are talking about the vaccine rollout for COVID-19. So tell me, what can we expect after we've gotten this vaccine? Can we just move about and be a little more free and not so isolated from our families and loved ones after we've
Well,
gotten the vaccine?
I wish that were the case. I do, but not so fast. There will come a day when we'll be able to say get back to normal. That will come, but no. Even when we get the vaccine, we're still going to have to wear masks and social distance and do all of those good things that we know to do for a little while. But once again, the important thing is that the vaccine is sort of I guess, a hope. It gives me hope that we are moving in the direction of, at one point, and hopefully sooner than later, we will be at that place where we can, roam around, roam around the country free,
Mhm.
which hopefully won't be too far away.
So I was on a meeting where the current director of the CDC, Dr. Robert Redfield, was doing a
Sure.
presentation last Monday, and he was saying that we will be dealing with this pandemic in some form or fashion for the next possibly 3 to 5 years.
Hmm.
If that's true, would it possibly still mean the physically distancing and mask? And people, what could that possibly look like? I mean, would it just be still we could see some cases here and there? um 3 to 5 years is a long time.
It is a long time, and definitely it's a bit discouraging to hear that. Certainly, I mean, the estimates I've certainly heard are not much less, though. The estimates I've heard are no sooner than 2022.
Hmm.
That already is 2 years away. The point being, regardless of whether it's 2 years, 3 years, or 5 years, I think the idea is that we're going to be in this for a bit of time. And I
Hmm.
think how things go largely depends on a number of factors, such as, how well these vaccines do, how many people get the vaccine, how much social distancing and mask wearing and things like that that we do now. I think that's one of the things that really should be stressed is that despite the fact that we feel like there's a lot that's not in our control,
Hmm.
and it's true, there's a lot of stuff that's not in our control, right? We're not entirely in control of ourselves, and our industry and our economy, et cetera. It's true, but we are in control of what we do and how much we try to adhere to and follow these guidelines that we know will make a difference. And I think one of the most important things is to focus on that. If we all do the things that we know we can do, we will certainly be in a lot better place than if we don't.
Hmm.
And I think that's really where the focus should be. And, also certainly trying to cope within this new normal, and being hopeful. This is not to say throw in the towel and just give it up. We're never going to get better. No, it's going to get better. But we really have to focus on doing what we know we need to do.
Yeah. So are there cases where people have tested negative, and there were false results, or even, I guess, maybe even the other way around? Because I've recently spoken with someone that felt like they had a lot of the symptoms, but
Sure.
they tested negative.
Yeah, that can happen. That's what you call a false negative. Well, if it's true that the person actually has COVID or did,
Hmm.
and the test was negative, that's what we call a false negative. False negatives can happen. False positives can happen too. That's when a test says you're positive and you're really not. That's something that can happen almost with any test, to be honest with you. How many or how frequent it is that the test is wrong depends on the test, the type of test, and things like that. For example, the PCR tests are more accurate, and more of the time than say the rapid tests. Okay, so different tests for COVID have different accuracy levels. But if we're generally speaking, yes, it's possible to test negative on a COVID test, especially if it's the sample is taken too early on in the disease state. Sometimes there's not enough virus to be picked up, to actually say that you're positive when in fact you are. It also depends on how good of a sample was taken. Remember, some of this is operator dependent. So if the person doing the swab, or if you're doing it, you don't get enough stuff on the swab, it may not pick it up either. There's a few different reasons why false negatives may happen. So that's why it's important to take a look at making sure that you're getting the best test possible, that you're also paying attention to your symptoms when they come, and talking to your healthcare provider about when the best way and how to get tested is. But yes, false negatives are absolutely possible. It's also, if I might say, why we can't fully and totally rely on tests 100%, to then go off and roam around the country, right? So that's one of the reasons why people say, well, I'm going to fly home. I got tested, I'm negative. Well, it's another reason why we're still cautious, right? We still say don't fly, even though we know people can get tested and test negative. Well, that test is only one point in time. You could have tested negative 2 days ago and now be positive because you were exposed to somebody en route on your travels. So understanding the limitations of the test is also very, very important.
Yeah, yeah. Thank you so much for being
Sure.
here today. And I'd like, as we move to a close, I'd like for you to just offer some final thoughts about just the precautionary piece as well as the vaccine, and, why we should be okay with being vaccinated unless there's some reason
Yeah.
why we should not.
Sure. No, I mean, I know that a lot of people have concerns, but I can tell you as a healthcare worker, I can't wait to get the vaccine myself. And I am encouraging my patients and my family to get the vaccine as well. It's something that I'm very excited about. Now, it's very true that we're going to be learning more and more about these vaccines as they move forward, but they have been and are continued to be studied and are deemed to be safe and effective. And that's really important. I would say if you have questions, it's really important to talk with your healthcare provider. There's a lot of news and things running around on social media, many things are not true. One of the things that I think is really important to do, I have a YouTube channel and a Facebook page, and I do daily videos trying to answer questions that people ask me. A lot of it about myths and things they might have heard, trying to dispel myths. So it's really important to get your information from good sources, to talk to your doctor if you are unclear. But I think, to leave, the conversation, I think it's important to be hopeful. All we can do is what we can do, but we can do that. And there's a lot of hope in that. And so, this is a day to be hopeful, and I hope everyone else is as well.
Can you tell us how we can access your YouTube channel?
Sure. Yeah. So my handle is Dr. Jen Caudle for YouTube and Instagram, and also Facebook. It's DrJenCaudle. Please, send me a message if you hear me on this program. Say hello. I do try to answer questions as often as I can. But yeah, please join me.
Absolutely. Well, thank you so much again for being here. We again want to thank Dr. Jen Caudle for being here today and sharing such valuable information as we navigate through these trying times. I want to thank you guys again for being here and just wish you a very, very Merry Christmas, just a happy holiday season. We will see you again on next Saturday at the same time, right here on 94.7 FM WOJG.com. We'll see you then.